HIPAA defines 3 categories of covered entities. This tutorial focuses on covered healthcare providers. The definition of covered entity is a general provision of Title 45, Part 160. There are 3 kinds of HIPAA covered entities. The first kind is the health plan. Health plans include Medicare and Medicaid. They do not include indemnity, disability, or workers' compensation plans. HIPAA doesn't cover employer-administered plans with fewer than 50 members. A healthcare clearinghouse is a covered entity. A financial clearinghouse is not a covered entity. Most healthcare providers are covered entities. Healthcare provider includes any person who is paid for providing healthcare in the normal course of business. Providers are covered by HIPAA when they use HIPAA-covered transactions. HIPAA transactions are standard transmissions designed to carry out financial or administrative activities related to healthcare. There are 11 categories of HIPAA transactions. The most common transactions are claims, payments, and coordination of benefits. A provider that uses a clearinghouse to process claims is always a covered entity. HIPAA doesn't cover employment relationships or judicial officers. And a PHR vendor is a business associate, not a covered entity. A health plan administrator is a business associate and not a covered entity. Once a provider becomes a covered entity, is he always subject to HIPAA rules? Now we'll examine the question in Single Peak, a fictional town in rural California. Priscilla and her husband Hudson have practiced medicine together for decades. They own a medical building on the south side of the plaza. Their attorney has an office on the other side of Main Street. The Pruitts employ an X-ray technician who also does medical billing. When Belle does the billing, she uses HIPAA transactions. Dr. Kramer is a new chiropractor who recently joined the group. He sees patients only on weekends and evenings. During the day, Kramer teaches health education. Today, Priscilla and Hudson are consulting Anne about Kramer's employment.
I'm worried about Dr. Kramer's job as a school teacher. We have patients enrolled in his health classes.
The function of teaching is not covered by HIPAA.
But he's going to be teaching medical subjects like sex education.
Kramer can answer general questions about sex, but he may not disclose individually identifiable health information covered by HIPAA.
What should Kramer do if a student discloses a medical condition that should be treated?
Kramer should send the student to the nurse's office.
Is a school nurse a covered entity?
No, the school nurse isn't a covered entity because she works for the school district. A provider that doesn't use covered transactions is not a covered entity.
But sometimes we fax children's records to the school nurse.
Those records are covered by HIPAA when your office maintains them. But they're not covered by HIPAA at school. The school is not a covered entity. Educational records are excluded from HIPAA. The Family Educational Rights and Privacy Act, FERPA, protects student health records.
Do you suppose Hudson and I could quit being a covered entity? We recently bought an RV. I would like to travel across the country.
If you retire from being a healthcare provider, you won't be a covered entity. But the records you acquire as a covered entity are always covered by HIPAA.
Wait a minute. I'm not ready to retire. And I've been thinking about starting a concierge practice that doesn't involve HIPAA transactions.
Are you trying to avoid HIPAA rules?
Yes, if I'm not a covered entity, I won't have to follow HIPAA.
That's true, but privacy law is embedded in California's state constitution. Any California business that owns computerized personal information is responsible for security breach.
I guess there's no point in trying to avoid HIPAA rules.
All you have to do is train Dr. Kramer on your office policies and procedures.
Thanks, Ann. We'll start training him right away.
Covered entities are subject to HIPAA rules because they engage in covered transactions. HIPAA defines 3 categories of covered entities: health plans, clearinghouses, and healthcare providers. Thanks for watching. We have more tutorials coming. Please send comments and suggestions to help us serve you better.